Well, welcome back to Insourcing Your Cancer Healing with oncologist Dr. Vishal Rao and myself. I'm a medical intuitive and my name's Julie Lewin. Wow, we have had such a great feedback from our first episode, Vishal. How has it been at your end?
I think a lot of optimism. I thank you, Julie, for opening up this conversation. I'm really very glad and happy that we actually started discussing on this on a casual note, and it ended up into a much more meaningful and very relevant discussion for both of us. I think it's been a learning for me, and I think a joy to share whatever my experiences are with you. And I think you've been a great support and a good story listener, teller, helping me interpret my inner thoughts and giving it a wonderful platform. Many people who have listened to this reached out to me, I think, with the fundamental thinking of the insourcing aspect of it. And I think that's the one that has inspired a lot of people to understand about moving from
Yes.
Curing to the aspect of integrated healing. I think it's hopefully going to benefit more and more people. So I'm glad we are having this conversation again.
And some feedback from my end. A lot of people commented to me that they found the story you told about lower expectations and have high acceptance and low expectations. They loved that. They thought that was very interesting.
That's thank you for that feedback.
Yeah. So
I think, but Julie, in this entire journey, what I realized was we both here are actually just witnessing patients as our teachers. I think all of these stories are about patients who taught me things, and I just couldn't fit them in my book. I think my book had taught me a lot of oncology, but my patients have taught me the principles of oncology way beyond these books could have imagined.
Mm-hmm. Yes. Everyone brings their own unique story and energy and creativity and inspiration to something that I know from my personal experience I would never have thought of. And I'm sure you're experiencing the same thing with your patients.
Yes, absolutely.
So it's pretty wild that we get to grow through doing what we love. And I think everyone can feel how much both of us love what we do.
Sure. Absolutely.
So why don't we continue the conversation, and why don't we talk about the statistical outliers that I'm sure everyone would want to know. What do you mean by that?
So, Julie, I actually, when I was coining this particular title today for our conversation, I was keeping you in mind. I felt you are a statistical outlier.
Okay. I am.
And I think the whole relevance of this discussion was when you said, Vishal, we should talk again, because many people have actually felt that we need to continue our conversations. I thought the second conversation could be around stories of people who have inspired me. So today I think first of all I would like to thank you for starting this. You're one of my first statistical outliers whom I've been very inspired by, and I think the whole story of statistical outliers is about people who beat the odds, and in my practice, how did they inspire my way of approach to oncology? So I'm just going to share that, and let me begin by talking about stage 4 terminal illness. This sounds more cinematic. This sounds more dramatic. But oftentimes we are taught that, oh, stage 4 means it's like terminally ill, things are bad. And, especially in my side of the world, a lot of people have a stigma with stage 4. It's a particular term that's like a alarm clock that's ticking, and it's like a time machine that's telling you that, okay, I think your time's up.
Yeah.
So I think today I'm going to talk a little bit about people whom I saw with stage 4 and what do they do with their lives, and what are they doing as statistical outliers today. So I
Yeah.
think my first story talks about my journey with Dr. Stan Wetzler and his wife Janie. They both currently live in the North Carolina, near the Blue Ridge Mountains.
Beautiful.
And one of the most interesting things that in my journey of learning oncology was my trip to Pittsburgh. I was visiting the University of Pittsburgh as a visiting scholar, and I did not have a place to stay.
Yeah.
I had reached out at that time to a couple of family friends, and I got connected with Dr. Stan, who was staying at Pittsburgh, and he hosted me at his house. It was one of the, it's a separate episode by itself if I would go on talking, and I don't want to kind of go overboard on that story. But every aspect of that journey of my unexpected landing into his house and staying with him was a beautiful aspect of what was in store for my learning. So much as I would have expected, I thought there's a gentleman, Dr. Stan, I think at that time he's been a physician himself. He was a former director of the Brentwood Medical Center. He stayed at Bradford Woods in Pennsylvania, beautiful place in Pittsburgh. And he would drop and pick me up every day. I had one of my most beautiful times of my oncology learning at Pittsburgh with the UPMC and with Dr. Stan.
Yeah.
But let's start by saying, I would always wonder, why would a person be so kind? Why he was so nice, kind to me, and he just hosted me to his house. He said, while my family thought I'll be staying at a dormitory, he hosted me at his place, and he had a lovely, beautiful house, a ranch, and it was so unimaginable for me and my family to imagine that I'm being hosted by somebody so kind. My first conversation with Dr. Stan was very interesting about he handing over a file to me and talking to me about saying, why don't you look at some of my journey? And I flipped through that pages, Julie. I look at all the reports, and I'm seeing a man with stage 4 colon cancer, metastatic, with some liver and lung mets.
Goosebumps.
Yeah. And he has completed his chemotherapy, palliative chemotherapy, and I think his team there had told him that, look, he has limited time and it's not working. So it was at that time that his journey in oncology actually began, when he started looking inwards, and we talked about insulin. So while I was talking and I was looking at Dr. Stan, and I was asking him, I said, so Dr. Stan, I said, tell me one thing. I said, how do you think, is this something that I can be of any help to you at this juncture? And he smiled and said, look, I'm not here to ask help from you. I'm here to teach you things. I've read a little bit about you. I've got some background on you. He said, I want to have some conversations with you. And I thought this is going to be a opportunity universe has given, where I'm going to teach you some things on oncology. And this was a kind of a counterintuitive kind of a surprise for me, that here he was telling me that I want to teach you something. And he asked me, he said, so what do you think about this whole thing? I said, I know the prognosis is very poor, things are grim. So what are you doing currently? You seem to be looking stable. He said, Vishal, you have not read my reports correctly. And I was like, so you're at this stage, you've been taking this chemotherapy. It looks like they've given you a palliative thing saying it's end life. So I don't know beyond this, what else can I tell you? I don't understand what is it that you are trying to allude to. He said, no, you learn to read reports. And that's why I put it in inverted commas, that's the opening line with which Dr. Stan opened my life to a new beginning. He said, learn to read these reports carefully. And he said, look at the dates. Those dates were nearly 10 years back.
Oh,
so
wow.
I think, if I'm not wrong, Dr. Stan must be 80 plus right now. He still is getting stronger by the day. And this was in 2008.
Wow.
Now, my journey with Dr. Stan, and every day I would wait to come back and spend time with him to learn every day about what did he do, what was it that he was doing. Because he would come home to my hometown, when he would visit India, I would say we would go to the treadmill. I would be running at the speed of 5 for like 20 minutes and then kind of taking a break, and he was running at the speed of 9 for non-stop, like 40 minutes. And
Wow.
I had explanations on how was he able to do this. Now here I was dealing with a person who was a statistical outlier,
Yeah.
ridiculously a statistical outlier, and I couldn't explain the thought of what would he have done for coexistence, what would he have done in order to look at healing, what would he have done. And every aspect of that story is a long learning, and I'm saying maybe we have to have a separate session to discuss our options in healing.
Yep.
That's something we will again have another episode for all of these patients.
I
But
would love that.
what I wanted to tell you, Julie, was one of the things that I learned from him was how do you give a bowing salute of time to cancer. So this is something that I just picked up from one of the references. Look at this graph of stage 1, 2, 3, 4, and parallelly look at survival, people surviving it. It goes on repeating, and this is for colorectal cancers, people like Dr. Stan. No, if you see the red dots, it doesn't hit the x-axis. It at one point keeps running parallel.
Yes.
So this gap that you see of these, the black and the red not meeting, is what I call the statistical outliers.
Right.
And these are the people who give that bowing salute of time to cancer. There's something they do. Let me start by a serious confession of saying sometimes I don't know.
Yep. Yep.
But there's something out there that they do that has this kind of a flip change in which the universe starts to work in coherence with them, with their body and with the cells.
Yep.
So I think the aspect we alluded to last time, coexistence, healing your cancer and healing your life, not killing, and changing the conversation.
Yeah.
I think our every episode should be focusing on how do we change this conversation in oncology.
Yes.
For a different perspective for a patient. And for me, it was about talking to statistical outliers and inspired by them, understand what do they do, what are the journeys that they follow. And I think it's about they changing the conversation. Chance that they get in this universe to give that additional time to the world is about changing the conversation.
Yes.
And I've heard from you, Julie, about how you've changed your conversation.
I have. Yeah.
And it was so inspiring to know that. And I think I'm just going to re-allude to this part about how, like what we spoke last time, one cell becomes a trillion cells. But me and you also started in our mother's womb as one cell.
That's it.
We were never called tumor or cancer. We were called with the most endearing terms.
Yes. So
how do we actually look at this, and how do we activate the big question in the sea, which is the immune system? Today, I think world over the conversation is around how do we activate, like in Dr. Stan's example, when entire tumor was all spread and it was still that there was still about 70-80% of the cells that were active as the immune cells. So I think that was the one thing that all of these statistical outliers do that makes us question that they activate the immune system in some way.
Yeah.
It's healing, whether it is through alternate therapies, complementary medicine, integrated approaches, prayers. Some people talk about vibrational healing.
Yeah.
I've found the secret code to this, the Da Vinci code to this particular C code, But I think there is more we need to learn, and I'm going to be looking forward after our conversation, Julie, for people to reach out to you to talk about how they have been a statistical outlier and post little tips, suggestions, share with us their experiences, which will actually help more people, more patients.
Yeah, absolutely.
I'm going to close out this conversation and open up to more questions from you with one more example, Julie.
Yep.
This is a very interesting patient of mine whom I met in 2015. She had a sarcomatoid carcinoma of the maxilla. To make it less complicated, a mouth cancer, which is very aggressive.
Mm-hmm.
The tumor was very advanced. We operated the tumor. It was stage 4. It had eroded the bone, but it hadn't spread. So we did a PET scan, and they said it hadn't spread. And at that point in time, I thought would be a very good example for us to do a curative tumor clearance. And we were able to do this in 6 to 7 hours, a complex surgery, removing of half of the upper half of the face below the eye, rebuilding it with plastic surgery to rebuild her face, a complicated surgery that took us hours.
Mm.
And the patient got discharged within a week. She came back for follow-up with the final histopathology report, which was looking quite bad. That means the tumor was aggressive. It was trying to spread along the blood vessels. It was trying to spread along the nerves.
Right.
There were multiple lymph nodes. So things like these are bad prognostic markers. And you would say that, look, the outcomes in these kind of cases are very aggressive. These are aggressive because most of them may not do well. And we need to be keeping them on a close watch for recurrences, but we would need to go aggressive on chemo and radiation. And at that time, I told my medical and radiation oncologist to look into this. And they both suggested that within the next couple of weeks, they would start a chemo and radiation on her to prevent the tumor from coming back while we had given curative resection.
Yep.
Now, Julie, look at this 2016 Jan. The report seems to look like, again, the tumor had come back in various spots, and the tumor had spread to the lungs also.
Wow.
So while we did the PET scan, because at that point in time, we were able to, we found that she came to me 2 weeks later, very dull, on a wheelchair, looking quite demotivated, fatigued, exhausted.
Mm-hmm.
So before starting the chemo radiation, they did the scan to see what could be the reason, and they suspected that maybe maybe there's possibly a tumor recurrence at that time, and that's what we picked up. Very aggressive, rare instance. I would say very rarely, in 1 to 2% of the people, do you see such aggressive recurrences. Sometimes that comes back within a couple of months.
Wow.
It's happened. Now, what happened with this lady? I'm keeping this lady in my office, and I'm going to go back to this PET scan.
Mm-hmm.
No, her son came to me 6 months later. I had written a list of medications we call metronomic chemotherapy. We had put them on some tablets.
Mm-hmm.
We had given them a list of things. We had counseled the family, and she went back with the family, and they wanted her to be spending the last few days at home. And my oncologists, also colleagues, felt that she's just got a couple of weeks left now.
Yeah.
6 months later, her son came to meet me. And he said, Vishal, I want to talk to you about, and typically they come to meet you to sign some insurance papers. They come to sometimes brief, sometimes they come to share some of the last parts of the journey, but they had not been on follow-up after that. This was quite some time later that I met him. So I asked him, I said, how is mom? And it was a very hesitant question. And he said, oh, she's good. She's doing fine. She's back to her gardening, and she's back to cooking, and she's getting back to her normal life. And I was like staring into his face, and I said, are you serious? He said, yeah. She's just getting better. And I said, okay. And I said, why is it that you haven't been on follow-up with me? We've reached out. He said, no, we didn't want to. We just felt that, we just didn't want to, again, come back to the hospital because she was not very keen. I said, okay. Yeah. That sounds a little weird. So I said, how is she doing now? Why didn't she come to meet me? He said, doctor, she's waiting outside the outpatient clinic. She doesn't want to meet you. I said, that's strange. I said, why would she do that? He said, she's scared that once you enter into your OPD, you may again plan the chemotherapy for her or plan another for her.
Yeah.
I said, that's not true. I said, we would like to meet her. At least I would like to see the proof. And she walks into my office, and that's her.
Yeah.
And I met her 3 months back, Julie. So I want to tell you that just look at the interesting part of this story. It's been 2015 to 2023.
Yeah.
She's going on. Okay. Now, at the time, 6 months later, when I met her, I asked her, why did you decide to come and meet me if you were so happy and improving?
Yeah.
And you know what she answered? She said, Dr. Rao, I want to be candid. You know what? I think I need a little bit of cosmetic surgeries. And I said, are you crazy? I said, you've got all of this spread here. You wouldn't want to go for a surgery at this point in time. But, you know, she completely took the complete, I would say it took me by a complete blind side.
Yeah.
Surprised to say that she is looking for a cosmetic surgery. And my plastic surgeon wouldn't agree until we do a PET scan. And she said, I don't want any more scans. I'm done with all of this.
Yeah.
Would you just suggest this to me? And we all said no. We the tumor board, the team said no. We need to see how is she alive first.
Right.
Julie, this was such a wonderful inspiration for what I call as a statistical outlier.
Yeah.
She came back to me, and today, 2023, 2015, 2023, she's still going on. She's still getting better. I think I want to end by telling this discussion, I think from my side, to say that we often say aggressive biology, killer disease, bad tumor, death verdict. Most treatments aim at killing negativity. And I think I'll close by saying, can we again change this conversation? I think it's time that we discuss together about healing and not killing. And I'll stop sharing my slides.
100%. And as you were telling the story, I'm reminded of a commitment that I made to myself: no more surgery. I'd had 6 major surgeries, tumors, like you name it. I've lost probably all the parts of my body that can be taken without me not being able to stay alive. And I made a decision in 2002, that's it, no more surgery. But that didn't mean that I stopped growing things. I just decided that I was going to fix what I was growing. And I would love to know what she did around stress, because what I made my decision about was, okay, where's the stress in my life? Because my body responds to stress in a funky way. So I just need to manage the stress and then let my immune system do its job that it was designed to do. And I've got x-rays or ultrasounds that in 3 months, I have had stress create a new something in my throat with blood vessels going to it. And so we know what that means. In 3 months of doing daily work on myself, because I started forgetting, Vishal, I started forgetting the stuff that I did on the in-sourcing journey because I was feeling so well. And then funky things happen. So I always return back to the in-sourcing journey, and I can reverse anything that starts. And my doctor actually recalled me a few years ago, and he said to me, Julie, why didn't you come back and get the results of your ultrasound? I said, they're always good. I didn't think that I needed to come back. And he said, well, they're not good. And now we have to do radioactive blah, blah, blah. And I said, oh, really? Do we really have to do that? He said, well, and I could see him panicking. And I said, I'm not really very keen on that. And he said, look, let me ring the radiologist and I'll see what he says. This is what the radiologist said. Look, it's over 3 months since we did that ultrasound. Let's do an ultrasound again and see what we're really dealing with today. And when I went back, his energy was completely different. He said, it's all okay. There's no blood vessels there now, and it's just a watch and see. And I said, great, I'll just keep doing what I'm doing. And that's the in-sourcing, doing the inner work. And that was only 2020. Like, that's in the last few years. And so I can feel, and everybody can do this, Vishal. You will feel when your body is off. That's when you start doing the inner work again. If you've let it lapse, you need to start asking yourself, where's the stress in my life? Where is the dissonance in my life? And start addressing those things. And that shifts the frequency or the vibration in your body. And it allows your immune system to do the thing that it was designed to do. And one of the things that when I talk with my clients is anxiety and panic attacks and stress. Like, anxiety and overwhelm and stress is the biggest thing that is underlying any medical condition that they bring. And I said, well, let's work with that. Let's clean your blood of whatever the stress is causing. And I love science. I love to read the medical science of what's going on in the body. And then I flip that a little bit and I see, what can I do energetically to use that science to help people do the inner journey work? And I discovered that the thymus gland releases, I don't know, is it a hormone, macrophage? I don't know even what it is, but it looks like a Pac-Man. And I went, oh, that Pac-Man cleans the blood. How can I make that happen consciously, deliberately? And I figured it out. And what happens when you consciously activate that, you get this warmth that floods through you. And that's you being aware of your bloodstream receiving a big influx of the macrophages. And then I did some other research and I saw that the liver cleans the blood in our entire body every 2 minutes. And I thought, right, okay, so if we can release those macrophages, it can clean our blood in 2 minutes. And then I asked my client again, okay, so you said to me you were 10 out of 10 for stress. Where are you sitting now? And some would say, I can't even locate it. I don't even know what I was stressed about. So they've gone from 10 to 0 in 3 minutes, activating their own immune system. Like, how wild is that? And I'm not doing the work. I'm helping them do their own inner work in recognizing where their stress is. And you can activate the thymus gland for a specific stress or for overall stress, and the body will do the work. You just have to give it the tools that it needs. And if your bloodstream is so full of stress, and I don't even know how to describe that, all of your immune system, it's dealing with that. It's not doing its maintenance work, day-to-day, minute-to-minute work. It's actually putting out fires. And that's kind of been one of the biggest things that I've discovered for myself. And I know this. It's my life's work, but I still forget to clean my blood and do my own insourcing work when everything's going along okay. And so sometimes we get sent these crises, cancer, other autoimmune diseases, any sort of thing that disrupts our health and well-being. That's a wake-up call. You're not doing the inner work. You're not insourcing your own healing journey. And that's why I'm so loving being able to chat with you, because I see a synergy of my life's work, your life's work, and helping people not be afraid of cancer.
Absolutely.
Embrace.
I think what you were alluding to, Julie, was in scientific terms, we call them cytokines. There are a
Right.
lot of bad cytokines that actually suppress the immune system. And strangely, as somebody, I was thinking, see, today, Julie, we live in such a paradoxical world where we are constantly charging our phones, charging our laptops, charging our cars, charging everything possible, but not charging ourselves in source.
Exactly. Why are we not doing that? And that's one of the things that I'm passionate about saying to my clients. You've got to recharge yourself. When you get on an airplane, they say at the beginning of the journey, if you need to use the oxygen mask, you put your own mask on first and then you help others. That's exactly what we need to be doing. Is you can't pour from an empty cup.
I'll add another point. In the flight, they say that switch on the air flight mode. So I think the point is cut off from the rest of the world and just be with yourself.
Exactly.
So, Julia, another interesting point I picked up was, as you were speaking, very inspirational. It was very beautiful. You're truly one of the statistical outliers that we actually were talking about. You see, I was reading about the Sri Lankan forest commissioner talking about during the tsunami time, many animals like rabbits, deers, who had cleared the area much before hours of the tsunami. While paradoxically, we had pictures of a person staring at the tsunami, looking at it, wondering what's this big wave.
Yeah.
Now, how is it that the human intelligence and consciousness was not able to grasp it?
Yes.
Because somewhere these animals were much closer to the universe, to nature, to consciousness compared to us.
I absolutely talk about that as well. The animals know, like 24 to 48 hours before. They're feeling the frequency of the planet. We feel it, but we don't understand it and we dismiss it. But
I was reading from Japan some of the interesting groups talking about how they use pets like dogs to pick up cancer. There was a BBC.
Yes.
I've seen some of these videos and things, very inspiring, and how these animals are able to actually, and this is what today in science we're talking about, volatile substances that can be picked up through devices. So we're working on many devices that can be picked up just based on and which the animals pick up. Okay. Now, Julie, interestingly, we talk about PET scan, and imagine this is a pet who's actually picking up the scan. So the pet in your house is doing the scanning for you.
Yeah.
So I think it's about that consciousness, and that's the point. It's not about, I think somewhere we have to respect conventional science, understand it. Like you said, you went for the ultrasound, you checked for it, but at the same time, we make our choices.
Yes.
We do have our choices in healing, and maybe I think the coming episodes we can again open up on what are our choices in healing, and what options do each one of these do, and what do they try out, and maybe we'll have more inputs from audiences who have actually been statistical outliers to talk about journeys like what you said.
Absolutely, that would be fantastic. So, what say we wrap up this interview or this episode and we put a call out for statistical outliers to share their stories with us in the comments?
Sure. Wonderful. Look forward to that. Thank you.
Yeah.
Namaste.
Thank you. Namaste.